The number of people diagnosed with diabetes in the UK has more than doubled in the last 20 years, according to new analysis released recently by Diabetes UK. The new figures show that there are now almost 3.7 million people living with a diagnosis of diabetes in the UK, an increase of 1.9 million since 1998. Hello everyone, welcome back to Ifechi Health and Wellness. I want us to go back to look at diabetes. I know in my other channel in the past I've talked about diabetes, but there's been disturbing news and statistics regarding this condition, so we cannot talk enough about it. Hence I'm bringing it up in this health and wellness channel. In my previous videos on the other channel, when I talked about diabetes, I mentioned that there are two main types of diabetes, type 1 and type 2. But the ones we are concentrating on more is type 2, because it's the one that is really can be avoided. Type 1, most of the time you have to be on insulin or have to be on treatment, but type 2 can actually be managed without medication. It can be managed by lifestyle change. The data also shows that number of people diagnosed with type 1 or type 2 has increased by almost 100,000 since last year. The data from Diabetic UK show that 12.3 million people are at risk, they are at increased risk of type 2 diabetes. 4.6 million people are living with diabetes in the UK, and they have not even been diagnosed. I'm using UK because that's where I live, but it's a global problem. Diabetes is a global problem, but I'm concentrating on United Kingdom, which is where I live. Almost 9 in 10 people diagnosed with diabetes have type 2, and it is estimated that there are nearly 1 million people currently living with the condition who don't know that they have it because they haven't been diagnosed. Counting the undiagnosed population, the total number of people living with diabetes reaches up to 4.6 million, as I said before. While type 1 diabetes isn't currently preventable, 3 in 5 cases of type 2 diabetes can be prevented or delayed by making healthier choices, by helping people understand their own risk in developing the condition and how to reduce it, and by securing early diagnosis for those known to be at high risk. 3 in 5 women, which is 59%, and 2 in 3 men, which is 68%, are overweight or obese. More than 1 in 5 children, 22%, are overweight or obese in their first year of primary school in England. This increases to more than 1 in 3, 34%, by the time they leave primary school. Diabetes UK is calling for further action. With so many at risk of developing type 2 diabetes, including growing numbers of children, Diabetes UK is calling on the government to take further action to tackle childhood obesity by introducing stricter restrictions both on junk food, advertising to children, and supermarket price promotions for unhealthy food. To support this work, Diabetes UK is also a partner in the NHS Diabetes Prevention Program in England. This program supports adults who are at high risk of type 2 diabetes to make lifestyle changes that could reduce their risk and demonstrate the urgent need for similar development in the other three nations of the UK. Diabetes is the fastest growing health crisis in our time, and the fact that diagnoses have doubled in just 20 years should give all of us serious pause for thought, serious cause for concern. Both types 1 and 2 diabetes are serious conditions that can lead to devastating complications such as amputation, blindness, kidney disease, stroke, heart disease, if people don't receive a timely diagnosis and begin receiving the right care. With more than 12 million people across the UK at risk, and the prevalence of both type 1 and 2 still on the rise, it is clear that there's a huge amount of work to be done. So people need to help themselves as well. Lifestyle change, I cannot overemphasize on that. Exercising. If you're overweight, reduce your weight. If you love high carbs, people will say, oh, I don't take sugar, but there's a lot of sugar in the carbohydrates we consume. It is very worrying, especially with children as young as 5, even younger, are developing this condition, are very overweight. Gone are the days when you see quite a plump child, you think, oh, this child is well fed. It's the other way around now. When you see a child that is quite obese, it means that that child is not properly fed. So parents, overfeeding your children is not the best way to show that they are healthy. Let us start on time. If we start early to introduce healthy eating to our children, they will actually grow up to be used to that. But if we keep feeding them with junk because we are so busy, we are in a hurry to cook, and we are feeding them with junk food and anything what we can grab, they will be used to that kind of food. So when you start introducing fruits and vegetables, they will be reluctant to have it because what they are used to are junk food. So parents, we need to do better for ourselves. We need to do better for our children, because this diabetes is now like it's a big epidemic. It's just like having common cold now. Most people are walking around with it, unfortunately, without even knowing. And when they now collapse with hyperglycemia, they will be wondering what happened. It's only when you check their blood sugar that you see that it's dangerously high. I'm going to stop this one here. I'm going to do a series on diabetes. I'm going to come up with a different thing in my next video. I don't want this one to be too long. Thank you so much for listening. Goodbye and God bless.